Thank you all so much for joining us. We have a really great agenda today with a lot of information. So as people are continuing to log into the webinar, I'm actually going to go ahead and get us started so we have enough time for the Q&A at the end. So thank you all for joining us today for Building Confidence for Clinic using Aquifer cases for powerful didactic sessions. My name is Megan Hotelling and I am the Community Engagement and Events Manager for Aquifer. Today, we're joined by our presenters, including Cindy Lord, Dr. Ravi Ramaswamy, Elizabeth Schell, and one of our student advisory group members, Lon Crofton. Before we begin the presentation, here's a look at our agenda for today. We'll take a look at the common challenges to teaching didactics, which is likely the reason why you're here. We'll also give you some possible strategies for this. And then we're going to dive into some really great stories and tips from educators and students alike. And then finally, at the end, we'll save some time for a live Q&A with our expert educators. And so before we begin the presentation, let's take a look at some logistics. Please make sure you use the chat. We encourage you to send messages to the host and panelists. We also encourage you to chat amongst each other. You can put your questions in the Q&A panel. There's a Q&A button option for that. And then we'll be monitoring that and we may be answering your questions during the presentation or we may be saving them for the end. And without further ado, we are going to go ahead and get started with that presentation.
Hello, everyone. My name is Cindy Lord, and I want to welcome you to this Aquifer webinar. I'm an associate professor at the Case Western Reserve University School of Medicine, a primary care PA, PA educator, and chair of the Aquifer PA Educator Task Force. Before we dive into how Aquifer can help, let's dig into some of the common challenges in teaching didactics. As you probably experience, some of the common challenges to teaching didactic include bridging the gap between didactic and clinical. Oftentimes, busy clinicians in local health systems or private practice do not have responsibility for formal lectures or didactic activities, and there's a disconnect between the learning that takes place at clinical sites with community-based preceptors and the information from cases or didactic lectures that core faculty present to students. Additionally, material might not feel engaging for students, as it might be too theoretical or sometimes too redundant, and the varying amounts of experience amongst the students can lead to disinterest. You may find you can't get through all the necessary content in the classroom. And one of the biggest challenges we all face is having enough time to find or write cases for a CBL or a PBL session, and then planning a classroom session on top of that. For those of you who may be new to Aquifer or may be looking for a refresher, Aquifer cases walk through the process of a complete patient encounter with new content revealed at each step. Each case provides the student with an opportunity to practice identifying the important findings of the history and physical, create and stratify differential diagnoses, identify their working diagnosis, create a concise summary statement about the facts of the case, and commit to a diagnosis and treatment plan. A helpful refrain for you may be to consider Aquifer cases as a standardized patient. We know that standardized patients can help students practice clinical patient care skills. Deliberate practice allows more time to dig deep, understand, and get feedback. With the wide breadth of Aquifer content available and the searchable content library, it's easy to find just the right case or patient for you to get to know and to incorporate into an activity with your students. Some benefits to using Aquifer include active learning sessions ready to use that are developed by experts and easy to adapt and make your own. Engaging students around the story and talk it through like a real patient. It gives an opportunity for preceptors to engage in discussion with their students about what was covered during these activities. It allows for creativity, like using the flipped classroom model, which keeps material from feeling redundant, and learners appreciate the case-based learning and pragmatic application of specific clinical tools. And finally, Aquifer helps with skill development and knowledge application. So now let's take a look at the principles in action with examples of how you can use Aquifer in your didactic curriculum. Building confidence and competence in students during the didactic component of the curriculum is a challenge for all PA, NP, and medical educators. This challenge is compounded by our desire to integrate more active learning strategies to better engage students and demonstrate the relevance of didactic curriculum to clinicals and ultimately to their career. The PA Educator Task Force was charged with looking for new ways for PA educators to leverage Aquifer to support their students. Our goal was to make it more efficient to connect PA educators with Aquifer content, tools and resources to help them teach content that's difficult to teach. What we came up with is a keyword guide. It's easy to use. It's got a friendly design with 2 versions, a PDF and an app. It's searchable, and it can be used throughout the didactic curriculum. With close to 70 keywords, it can be used in all aspects of the didactic curriculum. The keyword guide was initially designed with PA educators in mind, but with the inclusion of keywords from the major areas of didactic curriculum, including basic science, clinical skills, clinical medicine, counseling and patient education, as well as clinical reasoning and critical thinking, this tool is quite applicable to NP and medical school curricula as well. Each keyword is mapped to PA accreditation standards and competencies of a new grad. But I would say to our PA, our NP and medical educators on this webinar that you can easily see the association and similarity with the standards of accreditation and competencies of your own profession. For each keyword, the guide provides examples of Aquifer cases, then addresses the keyword as well as tips for curricular integration and teaching strategies. For example, the basic science section includes the keywords of anatomy, physiology, pharmacology, and genetics. If you were to use and search the keyword, say, anatomy instruction, you would find a teaching strategy that suggests using the integrated illness scripts to describe what goes wrong in various organ systems with your anatomy and or physiology classes. This will allow instructors to compare normal anatomy with disease processes. So an example would be in discussion of the GI system, say in an anatomy class, assign students to complete the GERD integrated illness script. Then in class, use the what's the UPI, fillable mechanism of disease map, to remind students to think about the role of anatomy. Both the UPI, underlying pathophysiological insult handout, as well as the mechanism of disease map can be found in the integrated illness script educator resource section of Aqueduct. Handouts like these save educators time while providing them with quality tools that can easily drop into their curriculum. The guide includes keywords related to clinical skills, including performing a physical exam, communication skills, history taking, and oral presentations. So if we were to search the keyword physical examination, we would find a teaching strategy that suggests we use Pediatrics Case 32, which is a day in a pediatric dermatology clinic. And we can use this to teach students dermatology terminology and skin exam documentation. Have students work through the case as pre-work, and then have them work as partners in class to practice writing skin physical exam findings for lesions shown in the photos provided in the case. The guide also includes numerous keywords included in the curriculum for clinical medicine, social and behavioral sciences, clinical reasoning, working on interprofessional teams, as well as counseling and patient education. So if we were to search the keyword behavior change, we would find a teaching strategy that would have students complete high value care case number 3, internal medicine case number 8, and medical home case number 1, and they would complete that as pre-work. Then, using the pair and share method in class, you would have students create a behavior change for a patient using the 5 A's of behavior change, which is introduced in the high value care case number 3. Pairs of students will share their behavior change plans with each other. So student 1 would create a behavior change for internal medicine case 8, and student 2 would create a behavior change for medical home case number 1. Then the class could come back together to debrief. Now let's take a tour of the Keyword Educator Guide prototypes. I will begin with a tour of the Keyword app. So we use an app called the Glide app, and when you open up the app, you come to our homepage where you'll see information just about the tool. And you can see there's a home button. You can search for words using major buckets or major competency areas like health literacy and communication, or interprofessional collaborative practice and leadership, or patient-centered practice and knowledge. So when you click on it that way, you'll see the keyword, and then you can click on that keyword and you'll see it expand out with lots of detail. Probably the easiest way is to use the keyword search feature. So for instance, if I were to search for the term, let's look at medical basic science. And I see that a number of things come up, and one of those is instruction in medical and basic science. So we see that our keyword is listed, instruction in basic and medical science. It lists the PA accreditation standard number. It then defines that standard. It lists the actual standard. It then lists the domains for the PA profession. And again, to my medical and NP colleagues, I would say that these probably closely parallel your competency and domains. And then we get into teaching strategies. And you'll see here that one of the suggestions is to use the Venn diagram activity card in the Integrated Illness Script Sciences section, their resource guide. And in that activity, students will study sibling integrated illness scripts before class. You'll identify a common clinical feature. So for example, here we use asthma and pneumothorax have dyspnea as a common clinical feature. And you'll ask the students to draw a Venn diagram from memory with the core concepts from each of the integrated illness scripts for that feature. Then you ask them to return to the actual integrated illness scripts and study how the mechanisms differ for the clinical feature in each script. You can do the activity with the entire class, or you can actually break them down into groups. After your teaching strategy, we actually list a number of exemplars of Aquifer cases that could be used with those teaching strategies. And for most, you'll see that it starts with a statement that says multiple cases can be used. So instead of listing all Aquifer cases, we've pulled out some of our favorites. And we list for this example, we list the integrated illness script, diabetic ketoacidosis, and then we list the actual science that's affiliated with that integrated illness script. After that, we list the PA core competencies for new grads that are associated with that keyword, instruction in basic medical science. And then what's really neat about the app is that it's kind of like crowdsourcing. You can share your own ideas. Maybe you have a new teaching strategy, you want to comment on the teaching strategy. And so that can be added right into the app at the time of use. And with the app, we also made available other search terms. So if you searched anatomy, you could come up with the same keyword and find that teaching strategy. If you searched physiology, it'd come up. So you have multiple different words that are similar, search terms that could be associated with instruction in basic medical science. Now let's take a look at our second prototype, which is a PDF version of our keyword tool. So here you'll see we start with our keyword guide, and we come up to the first 2 pages are set up like a typical PDF with a table, like a booklet or a resource guide with a table of contents. And so let's look down here, and it has the search tool. We can use the search tool of a PDF, or at the bottom of each page, you can also get back to the table of contents. And so if you go to the search tool and let's type in, how about interpersonal and communication skills? And let's see what comes up. Oh, there it is. So there's one, and that's the first search. So let's take a look at it. So you just click on it. And similar to the app, you're going to get a one-pager. It has the keyword listed up top, interpersonal and communication skills. With the number, it lists, it gives the definition of the ARC standard. It has the core competencies. It has a list of Aquifer cases. So here we see oral presentation skills, case 1, 2, 3, and 4, geriatrics case. And then as you scroll down, it has the integration strategies. So for this keyword, interpersonal and communication skills, one of the integration strategies is to have students complete Aquifer Family Medicine case number 13, which is about asthma, or geriatric case number 2, which deals with an elderly diabetic patient. And you have the students create that as pre-work, and you put them into pairs. And in class, you have the students break into pairs. So one who's done asthma and one who's done the elderly diabetic patient. And what they do is you have them practice the teach-back technique on how to use inhalers to manage their asthma properly. Or for the other case, how that elderly patient should take their diabetes medication and what to do in case of hypoglycemia. And again, once you're done with that keyword, you can just click on table of contents and it will bring you back. So you can either scroll through the table of contents, which lists the major categories: health literacy and communication, interprofessional collaborative practice and leadership, patient-centered practice, or you can use the search feature. So to summarize, the Educator Keyword Guide uses Aquifer cases to help meet accreditation standards, competencies, and learning outcomes. It easily brings active learning into the classroom. It provides a clinical connection to didactic curriculum, and it helps faculty learn to teach using high-quality clinical cases. For access to the prototypes, you can scan the QR code, which will bring you to the Glide app, or you can go to the link listed below, and you'll have access to both the Glide app and to the PDF. So in conclusion, I would like to say, try it. I think you'll like it. Thank you.
Hi, everyone. I am Ravi Ramaswamy. I'm an associate professor and the Director of Medical Student Education in the Department of Geriatrics and Palliative Medicine at the Icahn School of Medicine at Mount Sinai, New York. I also serve as the assessment lead for Aquifer Geriatrics. Thank you for joining. I will describe our experience with using Aquifer Geriatrics for our clerkship students. At the Icahn School of Medicine at Mount Sinai, we currently have a 12-month clerkship phase in the third year of medical school. I co-direct the 6-week ambulatory medicine and geriatrics clerkship, in which students rotate through ambulatory medicine and inpatient geriatrics and palliative care from Monday to Thursday each week, and spend Fridays in didactics and small group discussions and conferences. We have about 16 to 18 students every 6 weeks, for a total of around 130 students annually. Since the COVID-19 pandemic, we have done less traditional classroom teaching and more of independent learning via online modules, small group-based discussions, and virtual synchronous sessions on Zoom. We're really fortunate to be housed in a large department of geriatrics and palliative medicine with several advanced trainees, fellows, who are involved in the teaching. For the 6-week clerkship, we have identified 14 required clinical experiences, or RCEs, conditions that every student is likely to evaluate at their clinical sites. Here are a couple examples of the RCEs, which are relevant to their geriatrics experience. You can see that there is a level of specificity with the tasks they are expected to complete within that RCE. We also have alternate learning experience, in other words, a didactic or a learning material that complements every RCE and serves as an alternative in case of inadequate or incomplete clinical experience. Flipped classroom is an instructional strategy and type of blended learning that reverses the traditional learning environment by delivering instructional content, often online, outside the classroom. It moves activities, including those that may have traditionally been considered homework, into the classroom. You can see how it incorporates the components of the Bloom's taxonomy here. Over the next couple of slides, I will describe how we use Aquifer modules and the flipped classroom model in our didactics to teach two prominent geriatric syndromes, falls and dementia. For our teaching on falls, we use the Aquifer case number 12. This module, like all other Aquifer Geriatrics modules, has engagement questions, deep dives for additional learning, great schematics and figures for understanding complex concepts, and self-assessment questions at the end of the module, allowing students to apply the learned material. We assigned this case along with a couple short video clips that students must complete before the didactic session on a Friday. We expect that this should take no longer than 20 to 25 minutes in total. During the scheduled didactic, we engage our fellows to do much of the teaching. So there's an element of near-peer teaching and bi-directional learning. We split the students in groups of 5 to 6 students per fellow so that the learning environment is safe and interactive. The didactic session is a skill session focused on honing the students' history-taking and physical exam skills. As you can see here, the fellow role plays a patient who has fallen to allow the students to ask a history, then debriefs to reinforce the key history elements, highlighting the risk factors in the case. Then there is a demonstration of the gait and balance assessments and how to interpret them. Then there is some hands-on teaching on assistive devices like cane and walker, where we review the indications and practice using a card sorting game in the final minutes of the 30-minute session. As part of the preparation for the dementia didactic, we ask students to complete the Aquifer Geriatrics module number 4 and watch a 10-minute YouTube video on how to administer the MoCA, the Montreal Cognitive Assessment. The Aquifer Geriatrics module covers various domains of cognitive impairment, the importance of family and social histories, various types of dementia like vascular and Alzheimer's disease, common screening tests like the clock draw and the MoCA, and management, labs, imaging, and treatment options. In the past, we used to do a traditional PowerPoint lecture on dementia, but we realized that we are teaching most of the material that's covered in the Aquifer Geriatrics module, and students were exposed to some of this material in other courses and clerkships until that point in training. So we focused our didactic on practical aspect of knowing how to get a history and administer the cognitive assessment when evaluating a patient with memory concerns. So during the skill session, we again have the fellow role-playing the patient, and in some cases, the caregiver, teaching students the importance of getting collateral history. We then allow the student to practice completing the component of the Montreal Cognitive Assessment on the patient that is played by the fellow, receiving instant feedback on what went well and what can be improved. And the final minutes of the 30-minute session is spent in accurately interpreting and communicating the MOCA score and discussing any variants of the screening tests, like for those with hearing and visual impairments. We measure student engagement and satisfaction via anonymous surveys done right after the didactic, which has been overwhelmingly positive. Here are some comments from students before and after we launched these skill sessions. You can see that they appreciate the environment, they find the learning helpful and practical. We also have a formative OSCE 2 to 3 weeks after these didactic sessions, where students get an opportunity to demonstrate the history-taking and physical exam on a standardized patient and receive feedback on their level of competency achievement. So in conclusion, here are some of my tips. I encourage educators to assign Aquifer modules when possible as pre-work to a scheduled didactic. Most Aquifer modules take about 15 to 20 minutes to complete. You can complement with YouTube videos, and with SAQs being available for each case, you can use those as trigger questions to jumpstart the discussion. We must remember that student learning styles can be very diverse, very different from ours, and also different from each other. So independent learning via modules complemented with in-person skill-focused didactics can lead to greater satisfaction. And if you're changing anything, I would suggest doing a poll or a survey to see if it is working for you. Faculty and fellows love to get feedback from students about what's working and what's not. Personally, I love the opportunity to innovate and modify this curriculum, and I'm grateful to our fellows and faculty colleagues for their engagement. And of course, to Aquifer modules, so we can do more in less time. Thank you for your attention.
Hello, everyone. Thank you for joining this webinar. I'm Elizabeth Schell, and I'm faculty in the PA program at Baylor College of Medicine. And I'm also a member of the Aquifer Physician Assistant Task Force. I'm the course director for 2 courses, Problem Solving in Medicine 1 and 2. Students are enrolled in both of these courses throughout most of their didactic year. These 2 courses really put an emphasis on case-based learning and to develop critical thinking skills when it comes to patient care. I do this both in individual and group work. The goals of my course are to help students develop differential diagnoses when it comes to patient care. In addition, I work with students to develop an assessment and a comprehensive plan. My course is divided into modules, and each module encompasses an organ system. For each module, I will assign individual preparation work so students can adequately prepare for each case. Student preparation comes from 2 of our courses, which are clinical medicine and physical diagnosis. Students will focus their efforts on learning various topics that will focus on the following: pathophysiology of disease, risk factors, signs and symptoms, physical examination findings, diagnostics, differential diagnoses, and early management strategies. Providing this outline on how to prepare for these Aquifer cases ensures students have the foundational knowledge to tackle these cases successfully. Classroom work of Aquifer cases can be done on an individual or group basis. If I do an Aquifer case as a group, I will assign students to a small group. These students will work through a case together as a team. However, I throw a little bit of a twist in the case. I will allocate fake money to each group. I may allocate a total of $2,000 for each group. It will just depend on the complexity of the case. I'll also provide each group with a pricing sheet that's pretty extensive and includes basic diagnostic studies and pricing for imaging. As they work through the case, they will come to a question in which now they need to decide what are the appropriate diagnostic studies they want to order from me. They must have justification for why they are ordering these studies. So how do I teach this in my course? They specifically must use information in the case. And what information am I talking about? They must use information from the history and physical to justify why they are ordering that specific test. I take it a little bit further in that I want them to tell me what they are looking for. So for example, the patient may have a productive cough. So they want to order a chest x-ray. So then they need to tell me, we are looking potentially for pneumonia in that patient. So if they tell me the appropriate justification, then I will provide them with the results of that test. The goal of this is twofold. They need to understand that the cost of ordering these diagnostic studies is expensive, and they need to be very mindful for what they are ordering, and they need to order only appropriate tests for their patient. The second thing is they need to use the least amount of money to come up with the primary diagnosis, and the group that does this basically wins. On average, it takes about 75 to 90 minutes for groups to work through this case. So some of the outcomes and feedback that I've received from students actually really love this. They love working together as a team. They love ordering these labs and using this fake money. The reality is in medicine, when it comes to patient care, oftentimes a patient's going to receive healthcare from many different healthcare providers. So teamwork is really important in terms of making sure that patients get adequate care. These cases are great to expose didactic students to clinical scenarios. And it creates a safe space for learning. I tell my students oftentimes, it's okay to not know parts of this case. It's okay to get some of the parts of this case wrong. It's okay. I would rather it happen with me versus it happening in their clinical year or when they're actually practicing medicine. This really has built a lot of confidence in my students for their upcoming clinical year. I oftentimes hear from students in their clinical year and they'll contact me and they will remember a specific case that they worked through in my course, and they were able to utilize that information that they had learned and it applied it to a current patient that they've been working with. And this also reinforces professionalism with a group. In medicine, we work with all different kinds of people, and this provides exposure to that. Some tips and advice I have for everyone here. So prior to class, ensure students fully understand the components of basic labs. So they need to understand what's in a CBC, what is in a BMP, and what is in a CBC or CMP. You want to start this very early in their didactic learning. This holds them accountable for components of basic labs, and they need to know this for the rest of their medical career. Start with easier cases to get students used to the format. In my experience, a lot of times students haven't seen this type of casework, and so you want to start off with easier cases, and as they progress throughout their didactic year, you want to reach for more difficult cases. Allocate more time for casework in the beginning of your course, or if this is the first time you're using one of these Aquifer cases, you want to make sure that you give adequate time for that. So for example, if it's the first time you're using an Aquifer case with your students, maybe allocate up to 2 hours to work through that case. One of the things that I do with my students in my course is that I ensure that they don't change their answers as they move through the cases. The reason for that is that as they move through the cases, the answers to those initial questions will be revealed. And so the whole point of moving through these cases is for me to see how they work through, not to go back and change their answers. Inform students that they must have a valid reasoning from the history and physical to justify any diagnostic studies, which we already mentioned previously. You want to engage with the students. You want to listen to their group conversations. If students are going down a rabbit hole, you want to gently provide guidance on how to get out of that rabbit hole. And lastly, have fun. Thank you for allowing me to share how I use these Aquifer cases in my program.
Hello, my name is Lon Crofton. I am a second-year PA student at Case Western Reserve University School of Medicine out in Cleveland, Ohio. I also served as a member of the Aquifer PA Student Advisory Group this past year. And I just wanted to talk to you today a little bit about my own personal experiences with Aquifer. A little bit about my program. So my program is about 27 months in total. We spend 15 months of that doing didactic work, and then the subsequent 12 months is spent in clinical rotations. We have Aquifer cases integrated throughout our didactic portions and our clinical coursework. And then some of the examples of these cases include social determinants of health, pediatrics, geriatrics, family medicine, and internal medicine. So there are two specific examples that I want to pull from my experiences with Aquifer. The first case I want to talk about was a pediatrics case that I did that looked at a 5-year-old with puffy eyes. And the reason why these cases are so important to me as a student learner is that they really do a good job of breaking down all of the different explanations throughout the case for a student learner. So when you look at a patient, the first thing you want to think about obviously is, are they sick or not sick? And what kind of questions should I ask? And so Aquifer does a really nice job giving you various questions, but it doesn't seem like a script. It's very natural. It feels as if you're in a real patient encounter. And the way that they ask it kind of alludes to more information from the patient. It's not just list your symptoms. What is it? And then they give you the symptoms. It's an actual conversation with this patient throughout this course. The other thing that's really great is throughout some of the cases, there are physical exam videos. So it shows you exactly what you're looking for. Rather than just describing what you're looking for, it really shows you it. Because we know from a lot of research, students learn best through a multitude of facets. So not just reading, but visualizing, kinetic learning, things like that. So for me, this physical exam videos were very, very important. Yes, we have our physical exam class where you learn how to do everything, but sometimes it's really hard to simulate how you get those things in real life. So in this case with this patient, we saw ascites on physical exam, and the video shows a great idea of what a fluid wave would look like on an abdominal exam. The organization of this case was also really imperative too. It wasn't kind of all over the place, which oftentimes I know for sure when I started doing my clinical work, I was all over the place. I was at the HPI, and then I was at the physical exam, but then back to the HPI. This does a really good job breaking it down for learners as to kind of how does a typical encounter with a patient typically work, and what kind of questions should you be asking. The second case that I want to highlight is the social determinants of health module. So there's a whole set of modules. There's about 3 cases in those modules. But one of the biggest things with medical education as we're moving forward is really talking about the importance of social determinants of health and where they come into play when you interact with patients. And so these modules I thought were absolutely incredible. They first give you a great introduction into early clinical pearls. What are the things other than what you typically learn in your didactic coursework that you need to think about when you're working with a patient? How much does a specific lab cost? Does the patient have insurance? What even is insurance, and how can that affect the outcome of that patient? Or do they have preventative health care? Again, really great questions that really make you think. And so I was very fortunate enough to have my program assign these modules actually at the beginning of our entire schoolwork. So everything that we went through afterwards had that kind of lens of why this is important and what are the different factors outside of medicine that are affecting the care of these patients. Another really great thing about these modules is that they allow for cultural self-awareness. So they take the time, they explain to you, well, what is the difference between gender identity and sexuality? How does income influence the type of care people may receive or seek out? Another really great thing is emotional awareness. So if you look on the picture on the right here on my PowerPoint, you can kind of see an example of what this looks like from the student perspective, where it specifically asks you, why do you think the patient's father is upset? That's a really great clinical pearl and a really great way to self-reflect and think about, okay, this encounter isn't going the way I thought it was, or this patient seems very agitated. What am I doing on my end that I can ease this or try to get a better understanding as to what's going on with the patient? So these are just 2 really great experiences that I've had. But overall, what I really want you to take away from this is from the student experience, you get immediate student feedback. So once you submit an answer to the case, it immediately pops up with the answer below as to what the case was looking for you to kind of say or mention. It doesn't have to be exactly to a T, but it really gives a good student like, oh, I didn't think about this as part of my differential. I probably should have thought about this, or ordering this lab. Like I never really thought about it. But it actually not only tells you what you should have thought about, but it tells you why you should have done that. And I think that's really the key piece to take away is the why portion. Don't just order a bunch of labs because you can. Why are you ordering them? What is the purpose of them? And that's really important for the learning because it helps with the recall. It helps with just being a whole, a really holistic provider and really understanding the ins and outs of certain things. They have really wonderful learning tools as well throughout the cases. So if you actually look to the right side, if you saw on the previous slide, there's a set of tools. So as I go through the case, I can start to list what I think the differential diagnosis should include, what are important notes that I want to keep down as I'm going through the case. It really, again, helps organize the student's thinking. And then at the end, once you finish the case, there are these really great case summaries out there that provide me a really great opportunity to do like a quick review. So if I'm going back and I'm preparing for, let's say, my end of rotation exam or whatever exam I may be having coming up, there's a really quick, fast couple pages, maybe even one page of all the highlights that I should have taken from the case. And it's a really great study tool. I don't have to spend forever necessarily making all these hot sheets or anything like that. I can really just click on this case summary and use that. The other thing that it really does is allow for critical thinking skills. So the key to this whole thing is when you're in didactic year, I definitely know I felt like this. Students often feel like, oh my God, I'm just learning all these things and I never see any patients. And I'm not sure how this is supposed to work. These cases do a really good job bridging that didactic classwork to the clinical year that you're going to experience. Some students might have earlier clinical exposure, depends on the program, but I know for myself, this was imperative in terms of me thinking about how do I integrate didactic coursework into clinical experience? What are the types of tools that I'll need, or when do I know I should take a pause and think about, is there anything else that I'm missing in these things? So these cases do a great job in terms of that. The other thing is that it provides additional patient encounters that may be missed during clinical rotation. So as I mentioned earlier, we integrate this during our clinical year at CASE. And so if you're on a pediatrics rotation, a good example is right now there was an influx of RSV, but if you're in the summer, RSV might not be as prominent, or you might never see an RSV case depending on where you're doing your clinical rotation. But there might be a case on Aquifer where students can go and still learn about it and have an experience with a patient and what their presenting symptoms might be. How do we manage it? How do we test for it? It kind of supplements what you might not have seen in clinic. And then longitudinally, I would say Aquifer is one of the best ways I could have prepared for clinical rotations. I was on my first clinical rotation in a pediatric emergency department, and I did a number of cases prior to going to the PDD for my first rotation, both during didactic coursework, but also on my own, because I really found that these cases were one of the best ways to prepare for that, was to just go through and practice patient encounters. And that's what these cases really allow you to do. And a great example of this is oral reports. So throughout the cases, they ask you, if you were to go see another attending or ask your preceptor about this, how would you summarize all of the things that you just learned in the case in a short, concise sentence? And that's probably one of the most terrifying things you have as you transition to clinical rotations is how do I give a good oral report? But these cases really do a great job letting you get immediate feedback and seeing what is important information and what is not as much important information when presenting in an oral report. By the time I was finished with my rotation, it was amazing. A number of the preceptors that I had, both MDs and PAs and MPs that I worked with, were really surprised that this was my first rotation I've ever had. They actually asked me, when am I graduating? And that's how prepared I felt for my rotation based on using primarily just Aquifer cases in addition to my didactic coursework. As I mentioned earlier, you have increased critical thinking skills. So making sure you're ordering the appropriate labs, making sure you're asking the right questions to the patients. And again, Aquifer does a really great job spelling that out and giving you really actually good examples of how you should ask questions to patients. Instead of just saying, as a robot, what about this, and this, it's more of a conversation. Tell me more about what you're feeling. What are you afraid of during this encounter? Things like that. And then another really important thing is justifying orders and differential diagnoses. So that's one of, if you look at Bloom's taxonomy, that's one of the higher levels of thinking that students are required to do. But again, not just ordering things because you can. Why are we ordering these things, and how is that going to help move our differentials up or down, and how is it really going to help us solidify, what is the diagnosis for this patient? And going through these cases will allow you to have better long-term recall. So I know, for example, if we go back to that pediatric case that I mentioned earlier, it's presented with a patient with bilateral periorbital edema. I immediately, when I took my nephrology and endocrinology and urology exams, I immediately was like, oh, we should think of nephrotic syndrome. Like, that's the first thing I thought about when I saw a patient of that age, with periorbital edema. Not something I probably would have thought about originally when I was first learning all the course material, but definitely after an Aquifer case, I was very familiar with, oh, this is important and this is what I should be looking at. And then the last thing is the ability for students to make personal learning connections. And ultimately, better connections with material is going to give you better recall in the clinical exam setting and both on exams. Students oftentimes think, oh, I just have to memorize this, memorize this, memorize this. Well, it's two separate skills you have to memorize, but then you also have to be able to recall it when the time comes. And so the Aquifer cases did a really great job helping me be able to quickly recall important information. So some tips and advice when you're thinking about integrating these Aquifer cases into your didactic work or your clinical work. One is making sure that you allow ample time for explaining. Make sure you explain your learning objectives and your expectations for students. Additionally, make sure that you emphasize that this is safe space learning. So, telling students that this is a place where you can make mistakes. You should make mistakes. Faculty aren't grading you on whether you got 100% of these correct or you only got 75% correct. That's really important for students to feel safe as they're going through these cases, to feel like they can take risks. Another thing is making sure you talk about how do you access and utilize the tools on Aquifer, as well as answering just general Q&As. So even having just a 30-minute section where you allow students to just learn how to use Aquifer on the website, and then asking, do you have any questions about this, can make a world of a difference for students as they go and navigate these on their own. The other thing is integrating cases into classroom discussion and instruction. You should never, ever just assign cases to students and then have them never talk about them again in class. Some of the greatest things that I learned was from talking about these cases with other students in my class and learning how they were going through the cases and what they were thinking about and how that differed from my own. That was really an imperative portion of these Aquifer cases. Another thing to emphasize is quality over quantity. So it's not about the number of cases really that students should be seeing. It's about how they're going through the cases and are they really using those critical thinking skills that we're asking them to do. And finally, spending time educating students, how do you use these Aquifer cases for independent study? So once you're done with the assignment that you had, how can I use this to better my understanding going further as I start to move into clinical rotations? How can I download the case summaries and how can I use the case studies to help organize my thinking? That's a really important piece too, because Aquifer offers so much more than just the actual experience of completing them, but they're great references as well.
All right, very good. I would like to invite our panelists to come on. Excellent. And I'm going to turn this over to Cindy, who's going to moderate for us.
Great. Well, thank you, Megan, and thank you, Dr. Ramaswamy and Lon and Liz for a great presentation. I looked at if there's any Q&A, put it in the Q&A. If there's anything you want to put in the chat, feel free. We did receive the list of questions that when you registered that you submitted. So we can kind of go through some of those and you can all jump in and respond. So Lon, I'm going to start with you. You talked a lot about the value that you felt that Aquifer brought to you, but how about building confidence? Someone asked about how do you help build confidence in learners using Aquifer cases. And do you think that happened? And how, as an educator, could I do that to help you build more confidence?
Yeah, I think that's a great question. I think one of the biggest things for me, I kind of talked about it earlier in the slideshow there, was just that safe space learning. Knowing that I'm not going to get critiqued on every single tiny mistake that I potentially could make. I remember starting off with one of the cases and I had no idea for whatever reasons. I thought that everyone could see every tiny little click. So I would spend like 45 minutes like staring at one question, being like, oh my gosh, what do I say? And I don't even know what I should order. But as you start to go through the cases, and then you have that understanding that, okay, no one's watching you every click by click, you can take more risks. And I think that that's the biggest piece in regards to confidence, is students feeling confident to take risks. And then when the risks work out, or even if they don't work out, the importance of that learning aspect to them. And so even, again, the small little summaries at the end where they ask you, just write out a quick 1-paragraph summary. What did you think about this case? What is important? Why is this important? As I started to find that my responses were almost like neck and neck the exact same way, I was like, shoot, like, all right, I must know something. Like, this is perfect. I feel pretty good about what I'm doing now. So I would say that that's probably the best way that I felt that I personally have gained confidence through that.
Great, thank you. Dr. Ramaswamy, have you gotten feedback from your residents or with the teaching strategies you're using, or from your learners, or have you seen or felt that your learners are gaining confidence with the techniques that you're using?
Absolutely. Thanks, Cindy. So like I mentioned in the talk, prior to COVID, we would do a didactic and really spend a laborious amount of time talking about the risk factors and predisposing and precipitating factors. And we were really trying to reach learners with the same, different kinds of learners with the same kind of material. And I felt that now looking back, I don't think there's any other way than what we do now, which is independent learning, allowing them to absorb the material on their own. And we have seen that students, there's just overwhelmingly positive feedback. What we also do, like I mentioned, was we have fellows, so advanced learners like residents and fellows teach the material. And so I was just chatting with my fellow last Friday when we did this didactic, and there is just a sense of safety. There's just a sense of, just a close, because they're so close in training, they feel safe asking questions and getting answers to them. And fellows and residents have experience that is sufficient enough that they're able to answer some of these questions, obviously under the supervision of attendings like myself, if there's any kind of advanced level questions that I come in. We assess, satisfaction through surveys, and, again, they've been uniformly positive. And, passing that feedback to our advanced trainees can be very helpful, right? As budding educators, they value the feedback from students. And they can modify their own teaching styles and teaching techniques.
Absolutely. Well, thank you. So we have had a couple questions about, are there ways to use Aquifer for standardized patient didactic sessions? And I'll open it. I'll start, and Lon and Dr. Ramaswamy, if you have things that you've done or experienced, please jump in. So one way to do this is you have the cases, so you don't have to make up a case. They're evidence-based. And you can use your standardized patients, or you could use Task Trainer if you want. You saw there's like an OBGYN case, a mini case in diagnostic excellence. You could use that with a Task Trainer. But you could use pieces. You don't have to go through the whole case, but decide, what is your goal? Are you working on history, eliciting a history, or performing a physical, or is it that differential? Or maybe it's a couple pieces, getting a history and then developing a pre-differential diagnosis. So you can use the case and train your standardized patients to be the patient. And then students can go in small groups. You can do this interprofessionally. We've done it at CASE with nurse practitioner students. We've done it with nurse anesthetists. And they'll go in as we do teams of 3 students each. So we'll have three students from 3 different disciplines go in the room and start, while the other 3 observe outside the room. And then we will switch the follow-up or further questioning, a couple days go by and you have more questions, and the team B goes in and they give and they elicit more information. As a group of 6, they come up with a differential. They share that information, they get feedback, they debrief. So it's great for debriefing. And debriefing, there's actually a great podcast that Kelsey Doherty, she's from the University of Colorado PA program. She just did a really nice podcast on debriefing, and has a debriefing tool that the school has shared with Aquifer and with all of you that you could use that tool. So there are all kinds of tools in Aquifer. It's just so rich. The tip of the iceberg is when you get the cases, it's digging into them. But Dr. Ramaswamy, any other suggestions? And then Lon, after that, if you have suggestions or experiences you've had.
That's a really exciting way to use the Aquifer cases, Cindy. So that is giving me some ideas of how we can, go forward with this curriculum. We have not, we have standardized patient cases. We have OSCEs that follow the didactics that I described in this presentation, where the students have the ability to apply. So in these didactics, they're doing it in a very safe environment, low stakes, with fellows as teachers. And then a couple of weeks down the line, they get to do this in a slightly higher stakes environment with standardized patients in our simulation center and receive feedback again from standardized patients. And so I think there are many ways to align Aquifer cases, into your curriculum that then feed into the assessments of whatever program or curriculum that you have.
Great, thank you. Lon, how was your experience? You were on those teams where you did those kind of shared group visits?
Yeah, I concur. One of the biggest things that I definitely enjoy working with standardized patients is their feedback. Because when you first learn how to interview patients or things like that, you can come out as really robotic. When you just go, okay, OPQRST, okay. And patients will easily tell you, like, you could have worked on your interpersonal skills a little bit there. You didn't need to follow the exact guidelines. But having these Aquifer cases, one, I'm like, oh, okay, this now sounds familiar as you're telling me that that's where they came from. But two, they're really great. I mean, the best learning that I always have is through case-based learning, truly. I can stare at a book for as long as possible. I can stare at lectures for as long as possible, but I really integrate my learning through cases and through experiences. And the ability to even have interprofessional experiences too is amazing, because they come up with all this different ideas that I would have never, ever thought about. And they ask these really wonderful questions because that's where their training usually lies. And, it's not to say that we don't have that, just a different way of thinking. So I think that the standardized patient and the uses of these cases is an excellent way to integrate into didactic work.
Great. Another question that we had, I see where we're at with time, but I think we can squeeze a couple more in. Another question was in reference to how to use Aquifer cases with pharmacology lectures. And actually, there's lots of ways to do that. We have a number of asthma cases, but for instance, in family medicine case 6, which is a 57-year-old female with diabetes care visit, you can have students work on the case in class in small groups and design different initiation of insulin regimens. And then they can compare those, and you can do a large debrief with the whole class, where each team of small group of students presents their insulin regimen and why they chose that, and then follow up for the patient and best practices. So, easy way to integrate that, but there's great cases with asthma. There's adherence to medication. You can use the tool we just talked about earlier, but adherence to medication, that's certainly something that can be done in pharmacology. And that has a nice, the Geriatrics case 1, Dr. Ramaswamy, the one with the 85-year-old with using anticoagulant therapy. And that includes the portion of the case which is focused on treatment adherence. So students could propose ideas for how to encourage drug adherence, and that topic could be used as a basis for small group discussion, and students could share and describe their strategies for that adherence, for anticoagulant adherence. So there are just a plethora of cases that you can use for pharmacology. Let's see, other topics, and other comments. Dr. Ramaswamy, any other geriatric cases that you think about with pharmacology that people could integrate with pharmacology?
So all of the geriatric cases, incidentally, we have about 28 cases right now. They align with the competencies as published or as endorsed by the American Geriatric Society and the AAMC. And so the first couple competencies have to do with medication management and polypharmacy. So there are two cases, case 1 and that you just highlighted, Cindy, and case 2 that has to do with diabetic, anti-diabetic medication. So those two would really align well with pharmacology, or even clinical clinical work within a kind of geriatric environment. And then, it moves on to other competencies of, mind, mobility, medications, multi-complexity, and so on.
And I would refer all of you to take a good look at those educator guides in the Educator Resource Center. Those guides, when you open them up, I know the first few pages describe, but once you get into each case or you click on the case, there's, you can double click. There are handouts there, things that you just don't have to create. They're already there for you and they're linked to a case. So those guides, I think, are invaluable. There's one for every course, but high value care, medical home, geriatrics are just rich with resourcing. I think critical thinking skills, there was another question about how do you use these more for critical thinking skills? And I would say certainly, when you're linking your with pathophysiology, anatomy, your basic sciences with your clinical medicine, the use of the integrated illness scripts, really kind of an untapped resource for many. The activity cards that are included in that resource guide are just amazing. And they link with just about every case. There's an integrated illness script for all the major diagnoses where we have cases. So those are also really valuable. Another thing before we close out, I would just like to point out, and this deals with instruction in basic sciences. So things like genetics, which, those lectures can get a little bit dry. But, you can use the integrated illness scripts. So if you use, for instance, medical home case 3, which is a 2-year-old male with a language delay, and medical home 4, which is a newborn with multiple congenital anomalies, you can use those cases in class to prompt discussion. So what you do is you assign the students to complete the cases, and then you use there's a student learning resource in the case, and it's called the physician's role. Could say the provider's role for PAs and NPs, and before a small group discussion. And then you have the small group have conversation about the genetic mechanism of disease and communicating that with families. So you're combining your science, connecting that with mechanism of disease, and then you're connecting that with interpersonal communication skills. So the fact that you can use these and they layer, it's not just, I'm just going to use this for pharmacology, but you're threading them through your curriculum, I think is a huge value. So we're getting near time, and I just want to make sure that Dr. Ramaswamy and Lon, closing thoughts, any pearls, anything else. You did a great job with your presentations, but if there's anything else you'd like to add.
Sure.
And thanks, Dr. Ramaswamy, for sharing your educator guide. I see the geriatric educator guide is in the chat now. Thanks.
Yes, and I want to just follow up on the question you asked, and I want to point all our participants to the page 7 of this educator guide, which highlights which cases you could use if you wanted to, if you had a pharmacology or medication related kind of course. And as per this table on page 7, you can use case 1, 2, 3, 6, 16, 18, 19. So that gives you a series of cases that you can already kind of zone in on as you create your course. And similarly for other kind of competencies you may want to fulfill with your course or program. But thank you again for this opportunity, for your listening, and thank you, Cindy, Ilan, and Liz for teaching this with us together.
Great. Lon, parting thoughts.
Yeah, I mean, I kind of said it earlier, but I mean, there's so many untapped tools here for students. And from my perspective, at least, this was one of the best tools that I could have had through my didactic year. And now as I navigate through my clinical year, I'm thinking, oh, shoot, I'm so glad I had Aquifer. All these things are starting to come together. It makes so much more sense now instead of it just being, go do this, go do this. But, I've had practice to talk about those critical thinking skills in a safe space, and then going out and actually doing it in real life has been very meaningful. But other than that, thank you all for listening. Thank you for coming.
Thank you. And thank you again to Dr. Ramaswamy, to Lon, to Professor Shell. And I'll turn it back over to Megan to sign us off.
Perfect. Thank you all so much. That was wonderful. That concludes our webinar today. We hope you enjoyed it. If you have any questions, we'll be sending out an email in a couple days with the copy of the recording. So have a great afternoon, everyone.